We cannot stand with tension buildup around the ICUs in hospitals. These are the intensive care units for the patients who need critical medical intervention and mechanical support for saving a life. With emerging medical technology, medicine is paving ways to a high-end diagnostic and therapeutic future where nothing would be impossible or non-curable. Here in ICUs, exceptional and well-trained is present to deal with emergencies and save patients' lives. But apart from being well-equipped, either with high-end life-saving machinery and trained doctors, ICUs are still a place that carries evil in the form of multidrug-resistant organisms, MDROs. This is Earthy Perks, with a new episode to reveal the multidrug-resistant pathogens present in ICUs, causing you life-threatening diseases. While entering the ICU, you should expect to confront some baddies. Although you cannot see them, yet be aware of their presence. These are the hospital-acquired pathogens that are high on pathogenicity. Each time they show up with changed and somehow enhanced virulence. Hence, these healthcare-associated infections are fatal and can end up taking life. We all know that patients in the ICU face a suppressed immune system. They are susceptible to intrinsic infections and easily catch acute pathological problems. Here are some of the infections you should expect to roam inside an ICU, waiting for the next host. Number 1. Severe respiratory infections. As far as respiratory infections are concerned, the most notorious of all is pneumonia. It is a respiratory condition that needs immediate medical intervention, be it caused by a common pathogen or via MDRO. In both cases, the patient needs to be hospitalized, leading to severe respiratory and multiple organ failure. Under such conditions, the patient requires external respiratory aid and sometimes mechanical ventilation. 85% of community-acquired pneumonia, CAP, is commonly observed in patients. It is caused by Streptococcus pneumoniae, Haemophilus influenzae, and Moraxella catarrhalis. Other pathogens playing a significant role can be influenza viruses, coronaviruses, hantavirus, or Legionella. Pneumonia can lead to severe myocardial infarctions with a history of heart diseases. It can induce spleen dysfunction in splenectomized individuals, while it can also result in sepsis. Number 2. Infections associated with invasive devices. As the name implies, infections are caused by pathogens colonized or biofilmed around invasive devices' internal surfaces. The devices include endotracheal and intravascular catheters. The intravascular or central venous catheters devices show severe infections as they complicate with blood. Although the administration and removal of catheters are performed by and under supervision of trained staff, and infection prevention measures follow the process, patients show up with such MDROs. Number 3. Urinary tract infections. Patients admitted to ICUs are most susceptible to urinary tract infections. Hence, these are common HCAIs. Here again, catheters play a role and increase the number of incidents of HCAI in patients. The treatment is provided once the presence of bacteria and signs of disease is confirmed. The disease's symptoms are fever, lateral lumbar pain, and sensitivity in the costovertebral angle, hematuria, and delirium with recent onset. Once the catheter is removed, patients can show up the symptoms like polyuria or dysuria. Patients are treated with fluoroquinolones, ciprofloxacin, and levofloxacin. It is generally considered that ICUs are highly disinfected and sanitized places, and thinking of the presence of pathogens could not be imagined. Yet, you can acquire the most dangerous infections over here. MDROs get immune by repetitive administration of a heavy dosage of multiple drugs and show resistance. Hence, the HCAI by MDROs can be treated with a combination of antibiotics. The only thing you can do is take care of yourself so you don't have to end up going to ICUs. Earthy Perks and Clarnia bringing up an exciting offer. As a subscriber, tune to Clarnia.com to approach the world's classy home decor canvas wall art prints and get a flat $30 discount on health wall art. Use code Earthy Perks to avail of the deal. This is Earthy Perks signing off. Till next time, stay tuned and keep liking Earthy Perks.